Maingan and Dejnakas, Deshkanzibi and Donjiba, Maingandodem. Welcome to our newest segment of Niche Vibes. We're here to talk about various things. Today, it's a beautiful sunny day here in Kitchener or Waterloo, Ontario, KW we call it, but it definitely has a air of winter as we just got hit by a nice storm the other night, and we're starting to feel that winter effect, especially on the roads. They're kind of slippery out there, so if you're out driving around this time of year, be careful. Hope you got snow tires on. But Niche Vibes is always here to bring you special people to talk about various things. It doesn't have to be Indigenous in many ways. It's just conversations we have with some interesting people that we find that, you know, we want to talk about what's going on in today's society. And so as long as Niche Vibes has been on the air, we've been having some great conversations. And I really enjoy the people that come on because they like to share various, you know, things about what's happening in their lives. And so just wanted you to know that there are a few things happening in the Indigenous world today. What we're looking at today is the Assembly of First Nations meeting happening in Ottawa today, talking about various portions of Indigenous life. Child welfare has been a huge impediment to First Nation children, and we've found out that we need to control the lives of our children more than what we do have that's related to the Indian Act. And so major conversations have been held recently and negotiations have been held. So there's been some funding sources offered to First Nations, but they weren't adequate. In our last AFN meeting, the chiefs decided to reject an offer for a certain amount of money, but they felt that there was more to it than just having money put at an issue, and it requires more work. And so our chiefs have a very important role in determining the outcome of our communities and our families. And so when we look at these things, it's really hard for us to find that trust within governmental programs, because they seem to be limited in time and funding. And if we accepted the current offer, we noticed that there would be a time effect on this, and we wouldn't be able to resolve the issues that we face today. So I'd just like to bring you to speed with what's happening in the Indigenous world. Current events are always happening here in Canada and the United States. And I think we have a new era of new understanding, with reconciliation being very important to Canadian government today, and looking at the 94 calls to action. And so at our meetings, we usually ask the government where we sit, or where they sit, basically, with answering the calls that was brought about by the Truth and Reconciliation Commission, calls to action. And so we'll talk about those on our shows at times, and we'll talk about social events that are happening. We're seeing more and more Indigenous music being projected at the Juno Awards, where they have a classification now for Indigenous music, and we're starting to see more Indigenous people getting into the arts more than ever before. Got a chance to read the stories about Norval Marisol, who is an Indigenous artist who started a whole process of learning our traditions through art. And when we look at different artists that, you know, cover some of our spiritualness, it actually comes through quite clear if you go near a piece of art that has a spiritual, purpose to it. It kind of draws you to it, because it takes you into the story that the artist is trying to show you. And Norval was probably one of the greatest artists here in Canada, And when I think about the life that he had, it was challenged, but it definitely showed that Indigenous art and spirituality is something that everybody can relate to. And so I'd just like to mention this beautiful artist. But anyway, today's show, we're gonna talk about a very dear friend of mine who we got a chance to work with each other a few years ago, or about about a year and a half ago.
I think about that, yeah.
About a year and a half ago, at Grand River Hospital. There's been a major, I guess we can say a commitment in a sense to fixing some of the Indigenous health issues that we have here in Canada. And it requires a hospital to make a commitment to improve things. And so this is a day and age where we have to start looking at how that can happen. So Christine Peters has been tasked with a very tough role at the Grand River Hospital of engaging First Nation community members, trying to develop within Grand River Hospital a platform, so that we can improve some of the statistics. So welcome to the show, Christine.
Thank you for having me, Megan.
Happy that you're here, and took a little while to get you here, but we're here today.
I was just saying he's been priming me for this day for a long time.
Well, it's because you've been working so hard, and the things that you've been doing at Grand River Hospital, and now with the merger of two hospitals, the work has grown substantially. Mm-hmm. The things that you see at Grand River Hospital has really changed in the last year, and I think they're all for the better. And you were a big part of that, and getting the community involved, the administration at the hospital. So why don't you tell me about your role? How did you kind of get into a role like this?
That's such a great question. I ask myself that all the time. How did I get into this role? I say that as a joke, but I'm so thrilled and feel very honored to be in the role. So I started off as a dietitian and in cancer care, and then I moved into a regional oncology lead. And in the healthcare system, Ontario Health, or at the time Cancer Care Ontario, the provincial agency for cancer care, they were really the only healthcare provincial entity that had a really strong focus on Indigenous health. So they actually had, for over a decade, an Indigenous cancer care unit. So when I was hired on as a regional lead, I was also asked to take on the Indigenous health portfolio for cancer care. So one of my first tasks was to develop an Indigenous cancer strategy here for Waterloo, Wellington. So I think, I'll be honest, I went in not exactly knowing what I was doing or what to expect, but I had amazing mentorship along the way. And I think how I got where I am now is when we sat down and we started talking to community, we just kept on hearing that this wasn't just a cancer issue, this was a healthcare, this was a hospital issue. And so really, I think hearing community sharing the needs, the wants, the concerns, the barriers, and being able to bring that back to the hospital has, I think, opened up. And then I think with what's happened, right, with I think Canada becoming much more aware of the unmarked graves and all of that, the hospital was, I think, ready to hear and ready to act. So I think hearing those voices from our local community and being able to take that back, and I think it was time for action.
But your background, like you come from the Winnipeg area, so there was a larger Indigenous community there. Mm-hmm. Were you aware of Indigenous issues like growing up where you did?
No, so I actually grew up south of Winnipeg, about an hour, and it was it was actually a very Mennonite community. So a very specific kind of culture within the community. And then I moved to Winnipeg, obviously, for my first stint of university, and I think that definitely opened my eyes a lot more.
So you were acquainted to, at university, more about Indigenous things?
I think more. So I studied a Bachelor of Science in Human Nutritional Sciences, in Human Ecology. So I found it had a very, social determinants of health. So I wasn't so much introduced necessarily to Indigenous, but, I think a much more holistic view of health than, I think, when I look at my other colleagues, dietitians, I think a very specific view, but I think really my greatest kind of understanding or learning came when I started in the regional lead role here in Kitchener-Waterloo.
Okay.
Yeah.
And then you got acquainted to the Indigenous community here.
Yes. Yeah. So our first task, or the first thing we did was, the foundation, which is building relationships. So when we first, started on this work, we tried to meet with all the Indigenous community organizations, community leaders to really, sit down, build those relationships and understand, at that point, the barriers, the needs for cancer care. But as what we heard was so much more, of course.
Was that challenging in a sense, just trying to make a connection to the Indigenous community?
Definitely, yes. I think it was. I was very green at the time. I had great mentorship, and I think, when I'm now here, I'm looking back 7-8 years ago. I think I can reflect and see that this hadn't been done. I don't think any hospital in the region, or at least I know Grand River Hospital, had really sat down, had those conversations. So for some, right, it took 6 months, a year to sit down and have that conversation, and, you take that feedback back and you have a system that you have to work with to try to respond. So it definitely took time to build those relationships, to meet, to hear, and to respond and be able to start moving things forward.
I think what would be difficult is because of healthcare in Canada wasn't very kind to First Nation people. So
Yeah.
I think the reaction from the community, wanting to associate with a hospital would have been pretty difficult.
Yes. Trust takes time to build, right?
Absolutely.
I think a lot of I think what I learned very quickly is that need for consistent, right, focused, ongoing kind of being present in community. So we started off a lot of the work, attending powwows, sharing who we were, and just, I think in healthcare we try to start with an agenda, but we know that starting with an agenda isn't the right? There's a long history, and you have to build that trust and those relationships first. And it took time.
But I'm thinking about like the hospital hierarchy, they're there for a purpose of
Yes.
providing health care.
Yeah.
To venture off into a segment of population, there must have been some kind of change at the higher levels to be able to make this work.
I think I had a regional vice president. The regional vice president of cancer care in our region here was quite new, but I had really great support from her. And she was really, I could tell from the very beginning, she was very interested in, taking the time, doing this right, building those relationships. And I think she was a really big champion at that leadership level.
Do you think that it came from the TRC recommendations, or was it something more deeper for her?
For her, I sensed it was something more deeper. That was, yeah, she's kind of, I've always found her a real, an advocate for Indigenous and other communities.
Because I think this is where we see momentum is somebody has some experience, could be positive, could be negative in a lot of ways, and that kind of promotes what and how much energy you want to put into something.
Exactly. I need to ask her that, actually, Megan.
Yeah.
To say, what was the driving force, right? Why did you, because, there's a lot of work, there's a lot of other work too, so you also need that support from leadership to give you the capacity, the space, and want to respond, right?
And that's not always recognizable, at larger institutions, because you have a mandate and there's things you need to do. And how can I spend or invest, in a particular segment of population when you have, health issues in general in Canada that you have to kind of work toward.
Exactly.
Or work for, yeah.
Yeah.
That's why I always dig in. I always try to find out how this all began and what motivated people to do things. But the more that you start to reflect on or learn about Indigenous communities, have you built some good connections and friendships through that?
I think so, yes. Yeah. I reflect on, it hasn't been easy all the time, this work for sure. And I think hearing from community and then, working in a very large system, I think one thing I can reflect on is I really felt the support of community as well. I think that recognition that it is a tough system. And so I definitely feel like I've got some good friendships that are not just because I'm in this role, but because, we've spent a lot of time sitting down and talking, not just talking about work, but talking about what's important to us, right? So I feel very honored.
I know, well, we won't go into specifics, but we did a circle in the community with cancer, right? And we just wanted to get some experience of their, how they were treated at the hospital. And it kind of opened the door, at least for some conversations. Because not all the stories are going to be good. Yeah. In fact, some of them are terrible in a sense. But, as long as there's somebody that we can kind of turn to and start having these conversations, then I think the road gets better.
Yes.
Because even at that circle, we met with challenges.
Yeah.
But I think overall, the happiness of at least having a conversation so it gets better for future generations. Did you get that kind of feeling?
Absolutely. Yeah.
And then we can kind of use that information to make it better. But you're in a different situation now because two hospitals are merging. That doesn't happen very often.
No.
And so there's a lot of challenges with the merger of two hospitals. And one traditionally was more of a Christian-based hospital.
Yes.
Which kind of where Native people had found challenges, especially at residential schools, that were pushing Christianity. So to attend a Catholic hospital came about with challenges in itself. And now that they're merging, I'm not sure if you felt that or you start to see there's any reference to a religious-based hospital at all?
Like if the future hospital will kind of have that same religious kind of mandate or...
Yeah, that's the part. I'm not sure if they're going to converge with their values.
Yeah.
Or are they going to just go strictly health now?
Well, ooh, I have lots of thoughts. I think, and I think I've learned this even more doing this work is I think a lot will be determined as well by the process we take to get there, right? So, hospitals are publicly funded. We often think it's, I like to think about the hospital as like we're the community's hospital. We work for the community. Who is the community? What are the needs, desires, wants, values of our community? So I haven't heard so much about kind of that religious focus being brought into the community, and I think what I see and in this next phase is a real desire to engage the community in creating what this new hospital is and what it needs to be to serve the community. So I kind of feel like if we do that process right and we're responding to the values and the needs and the wants of our local community, hopefully it becomes a hospital that serves and has the values of the community.
And that's kind of like why I wanted to go there with this part of the conversation is because if we traditionally, followed our values, especially when it comes to the school we send our children to or the hospital we attend, now that First Nation people is getting more prominent in knowledge, how can that be a part of a new hospital where traditional healing methods can take place?
Absolutely. So I think when we say community, you're like, what does that mean, right? And when we need to have the values of the community, well, the community here is very diverse, right? But I think to your point is, and I think this is the next foray, and I hope where we're going right now is, the First Nations, right? They are the first people in this region, of course, as well. So that needs to be underpinning. And when I say we need to work with community to develop those mission, vision, values, right? I think a big piece of that is working with the local Indigenous community and the communities whose territory we're on. So, I think we often take this, like, I dare I say, like this equality approach. We're going to talk to everyone and we're going to put all the feedback into a bucket. But that's to me, that's not the next foray of this work. It's like, who do we really need to talk to? Who do we really need to? It's not just one, but I think we really need to work with the local community on this next foray. I'm really hoping that the mission, vision, and values will have that underpinning of reconciliation.
And not just in the vision plan, but the needs plan, because when you look at it, it's really hard to gather Indigenous statistics because we don't always participate in surveys and things like that, or we don't even keep track of them at the hospital right now. So, but we do know that Indigenous health is suffering. So with that said, that could be a motivating factor for a hospital.
Absolutely.
And it wouldn't be different if it was any other cultural group, but the first people of this land have signed treaties and had given up major portions of land here in Canada with the understanding that those services would be available for them. And so that's really what I try to promote to industry, not just hospital, but educational and corporations, that there is a moral and sometimes legal, need to do that.
You're right. There's not a lot of research, but we know the inequities, right? We know that chronic diseases, cardiovascular disease, cancer, diabetes, right? We know the incidence rate is much higher. In cancer care, we know that cancer screening, diagnosis is often later, which results in adverse outcomes. So I think we, as a hospital in Waterloo, Wellington, and elsewhere, we have a responsibility to address that.
When I think about it, when we do want to make society better, like I was thinking back during the pandemic, First Nations were targeted right off the bat for the vaccinations. But there was an air of insecurity around that too, because a lot of the vaccinations hadn't had long-term, study yet. And then we felt like in First Nations that they were kind of the guinea pigs.
And there's a history of being tested on, right?
Absolutely.
In the residential school system.
Absolutely.
So I could imagine that could feel like a repeat of history.
It triggered those feelings for sure.
Yeah, for sure.
Because they did nutritional experiments on Indigenous children in those schools. And now that it's coming to light, when something new happens, like a pandemic or vaccinations, well, do we want to be the first ones,
Totally.
So those are challenges that we face too. Like, if we think we're doing the right thing, sometimes we forget about the social history. And that's what we need to start understanding, at many facets of society, because those triggers happen, pretty easy.
Definitely.
So I think at Grand River, though, I think I got a chance to meet with the board. I got a chance to meet with the executive team at a number of hospitals now. And we're all at different stages. London actually has started this process a few years ago, and they have a healing center in the London Hospital, Victoria Hospital. Here, we're going to build a new hospital. And we're at the beginning stage of even architecture. Over time, more of the programming that's going to be offered there. So I think it's a really great time, for building this inclusion in the new vision of this new hospital.
Definitely.
So are you feeling like, by working at the hospital, that this is kind of, the hospital has so many different sections, right? You get your nurses, your doctors, and people, staff. Do you think it's starting to penetrate the hospital totally?
Yeah, I think, in the hospital we love measurement, and they're like, how do we know we're successful, right? And I'm always like, I don't know how to measure that, right? And, we can get a little tied up in the measurement, but what I've observed, and I would say, like, I've I've been with the hospital, kind of in doing this type of work since 2017. And I think about like kind of the push and the pull, right? So the push is like, we're developing these strategies, we're hearing from community, and these are the things that we want to work on and respond to. And then the organization has the thing that they're working on, the new hospital project, the merger, all these other projects. And what I've noticed is the number of people coming to me and saying, we want to include an Indigenous lens or the Indigenous voice, or we don't know how to do this. So I'm seeing I feel like quite a significant shift from, me saying, hey, what about this? What about that? Have you considered this? To people saying up front, this is what I'm working on, Chris. How can I? So I feel like I'm seeing that shift. And then, I recently was chatting with the Indigenous patient navigator, and, she just, as you said, we're all at kind of different stages. And one of the pieces of feedback she gave us was, we might not have our policies and procedures, and I know those are very Western things, all sorted out. She's like, but she's feeling this willingness to figure it out. So if a need comes up with a patient and the team doesn't know exactly what to do, she's not hitting those barriers that she might have expected to hit. But that openness to be like, I don't know, but I know that there's something differently we can do. So that's kind of what I feel like I'm hearing and seeing.
So will that come from knowing that the hospital wants to act on better Indigenous healthcare, like from your leaders? Like, does that trickle down?
What I've noticed is, I would say our leadership. So I think this happened definitely with COVID. There was a lot more engagement with leadership, right? There was a lot more like town halls, right? And like meetings with staff. And so that's kind of continued on. And what I've seen and noticed is our senior leadership, especially really bringing this into almost every meeting, almost every town hall. We're hearing some reflection, update, celebration, sometimes not a celebration, right? So I feel like, senior leadership, what they talk about sets the tone to the organization, what they spend time and energy on. And I'm seeing them, talk about this work. I get texts from some of my colleagues and they're like, Chris, how does this make it into every meeting? And I'm like, that's the goal, right?
So tell me about what we did there last month with the unveiling of the art.
The Indigenous artwork. So I think this is something we've been hearing for a long time is like, hospitals are not safe spaces, and, even just walking into a hospital is not safe, and, seeing yourself visually represented can have a big impact. We also, I work closely with our diversity, equity, and inclusion manager, Uma Maharaj, and she developed employee resource groups. And one of the employee resource groups that she felt was really important to develop was the Indigenous Employee, they're called Indigenous Employee Circle. And, when we talked about what was important, that's one thing that they highlighted was, I think one of the top priorities that they recommended the hospital work on was, some visual spaces, right? And so we had this is back to the cancer program now. When we were just starting off this work, we developed a relationship with a local artist, Luke Swinson. And I think we met him at a powwow and bought some of his prints. And he ended up donating some of his digital prints to us so that when it was National Indigenous History Month and we would take over the screen savers and share different did you knows, there was the art to go along with it. So he had been kind of supporting our journey for quite a while. And so, when we got that support to put in our first art piece, the Indigenous Employee Circle, felt very passionately that we wanted to work with Luke on that first piece. So we did a walkthrough with, the Indigenous Employee Circle, a few community members. I think we had a few community members, and Luke, and looked at some spots, looked at some options, and we ended up landing on the main registration space.
Okay.
So that space where people are sitting, there is kind of that access point to a lot of different areas of the hospital, not the Emerge and some of those programs, but at the other programs. So there's kind of 5 windows, and he developed a bird under each window, and it's the birds along the Grand River. So he wanted to bring some peace, reflection on the Grand River into that space.
It's beautiful too.
It is beautiful, yeah. I think it was really exciting it was really exciting for the organization too to see, something physical as well.
I was reflecting on the unveiling day, and the people, they sang songs. We did a smudging ceremony outside. So we launched it with ceremony, and people joined in the circle, and we did a smudging ceremony. We came inside, and we got a chance to see it and the employee circle brought their drums, and they sang some songs during that time. So, it captured the attention of people that were in the hospital. I noticed they were stopping by and watching and seeing what was happening. So it's kind of like a seed that's took off quite well,
Yeah.
There are times when it's going to be slower and things won't work out as good, but in general, I think we do have a good foundation now.
I do think so, yeah.
And you were a big part of that, because you had to maneuver between an uncomfortable community to an uncomfortable, organization. Didn't know how to engage that much, so you're able to find that pathway, which is great.
Thank you. It's been definitely it's been a learning journey, but a good one for sure.
Yeah. So looking forward though, like what do you vision now? Like, I mean, the dream is still there. There's a lot of things we still have to do.
Yeah.
But thinking about how it was going to look now, I'm just curious about what your thoughts are on that. Like,
Where do I start my again?
yeah.
Do I start with the wish list?
The wish
I'm
list
just kidding.
works. Yeah.
Well, I think, first of all, we're in this very pivotal point right now where we are merging, and it's a new start, right? A birthing of sorts. So I think, we have this opportunity to take, I hope, that foundation that we've built and really bring it to life and cement it into this new hospital, the planning, right? With this new hospital, right? We have the opportunity to create spaces very differently. So not just the look and feel of the overall hospital, but also ensure that the hospital will be able to respond to the needs. And then the work is getting bigger than me and my ability, and I lean on you and other community members a lot, right? So I think the next foray too is for the hospital, and we're seeing this across Ontario, is really creating a program, right? A team that can move this work forward in a good way, can engage robustly with community, that can work alongside community. And then something I'm really excited about is that Indigenous Advisory Circle.
Nice.
Right? So, making sure that, the worker bees inside are, working with, accountable, and responding to the needs of community in a good way. So,
Just to let people know that there is a Indigenous advisory group of people now that will be able to advise the hospital, and we'll have our first meeting in not too long, in December here, which is be a first.
yeah, been a long time coming.
Absolutely, and they're comprised of community members. I think will aid the hospital in knowledge and understanding as we grow.
Absolutely. Yeah, I think that's, I think once you bring in an advisory circle, the work and how you work with and that accountability, it has to change, right?
And I think it will, because like I said before, when people weren't going to hospitals because of past, experiences. Now they can see that there are supports there. The navigators, do their role and they help people through the process. I think it just has a more welcoming effect now.
Yeah. I think, I don't think, for community and for us, I don't think we know exactly what this is going to look like. And I think we're at a good time because I think it's taken us some time to get comfortable with the not knowing, right? So I think we're at a good time, and it's the right time for it.
And that's where I think I see the obstacle. Society likes to know what's going to happen, lay it out, in an outline form.
Yes.
But Indigenous people don't kind of do that. We're more, we'll make it work, and it usually does, but it's just in a different way than we've grown accustomed to.
Totally.
And I can see where that can cause a stress for people that we when we were just devising the agenda for our first meeting,
Yes.
it just can't come across as 502 we're going to do this, 507 we're going to do this. It's just going to take on its natural life.
It feels like this ongoing balance between you want everyone comfortable, right? But you also want to allow it to emerge the way it's supposed to emerge, right? So I feel like it's always walking this balance between different ways of doing things.
So you set the mood and the tone to have a good conversation. So food has to be there. Food is always a draw. Like if you look at food itself, how we grew up around the kitchen table,
Yes.
family would get together and they would talk about things, and we kind of got away from that now. People aren't even having dinners together anymore.
Yes.
But when you do pull them together, food is kind of like a medicine.
Absolutely.
It'll bring people together and you can have conversations that you probably wouldn't have.
Yeah. So I don't know if I think I mentioned this in the beginning. I'm a dietitian by training.
Right.
Right? And people often the first response I get is kind of like, ooh, is this healthy? And I was like, but I think I get a little frustrated because like you said, food is so much more. Food is community, right? Food is social. Food is, I don't know, it should be enjoyable. So I think it can really change the tone.
So that's just put in my mind, your educational experience with nutrition, and it kind of conflicts with the social element of food and what it can do, right?
Yeah.
Because you can look at a body and see what nutrients the body needs.
Yes.
But even if you're feeding a part of your body, maybe the social part of it is disappearing out of that.
Yes.
Is that any kind of topic that, how do they converge those in education?
Yeah, that's a great question. I think I was, when I reflect on, so I moved obviously right from Manitoba to Ontario, and when I reflect on my schooling in Manitoba, I think it had, being under human ecology, I think it had a little bit more of that lens. It was also family studies was part of it, right? So I do feel like it wasn't just the, dare I say, the science, the biology of food, but it was a little bit bigger. But I think when I was looking at where I wanted to train as a dietitian, I think, not every program is the same and has the same mandate. So I think I really looked for training that would kind of align with my values. And so I ended up, and kind of build the skills I knew I didn't have. So I think I've always had a bit more of that, there's the training, but then there's who you are as a person, and it's hard to sometimes pull out the two. But I ended up training at St. Michael's Hospital, now Unity Health. And I think I was really interested in, learning more about what that inner city medicine looked like. Yeah.
Do they talk about different cultures in food, in your education? Yes. Here, our natural foods would be like fish and wild rice and
definitely,
natural foods.
I'm racking my brain now. I was like, which course was that? And now I'm getting confused because for a little while I also taught chefs at Conestoga College, right?
Oh, I didn't know that.
Yeah, I did that for a few years. And one of the major projects in that was we actually asked them to, so now I'm getting confused between my education and what we were teaching to these chefs, but one of the projects was to look at food through the cultural lens. And so we asked them to pick a country and look at the history of the country and how the food evolved in that country, from different lenses, including that social lens. So honestly, that was my favorite part. They would come back and they would present, and I got to learn about the history of all these countries, the social, how they viewed nutrition and food, and kind of what was happening. So I think more and more, and what I've heard from my colleagues that were trained at the same time as me is, I think they reflect on the program and wish there was even more of that. I think a more holistic view of health in our training, because nutrition is like, I think the interesting, now I'm trying not to nerd out now, but the interesting about nutrition is like, people don't come to you and you tell them what to do. Like, food is very personal to people, and they have to be willing and they have to want to. And I don't even like saying that, willing and want to, but it's like, if it's not realistic, people aren't going to do it, to make changes. So I think the best part is knowing who the person is, what's important to them, right? And I always thought, like, I'd been successful as a dietitian if I didn't tell them what to do. They told me what their life looked like, what their priorities are, what they liked, and if we had some health goals, we found some ways to, make slight adjustments within their food system.
Did you happen to work with Chef Philippe
No,
at Conestoga?
I didn't.
Oh, he was a really supporter of indigenous. There's an indigenous chef that's on TV. His name is the Wolfman. They call him. He's on APTN. But he's been trying to get him there for years to bring some indigenous food to the program there. And this is what I'm saying. Like, people are have their own experience with indigenous people, and they want to bring it into their professions, right? So this was always a fun thing to do, trying to connect people and make it work and watch it go. So, but food, like, for Native people has always been a challenge, because we've transitioned, to our natural food to more processed foods, and even the environment that we live in has been tainted, I guess. Now, even organic food has been affected, by pollution and things like that. So one of the stories that we had was a little bit about the settlers coming to North America, and they said if they came in good gesture and happiness, we could actually build on the knowledge that we have. But if they came in anger, with weapons, they said that the outcome of that would be our inability to use our natural resources, like our food that grows naturally here. They said if you can no longer eat the fish out of the rivers, that means that it didn't happen in the proper way. And so when I think of those 7 grandfather teachings that we have, and even our ability to look at our prophecies of how this relationship would turn out, it was pretty accurate in a lot of ways, because we can't eat the fish out of the rivers now. And we've been challenged, with our natural products, being infected, so now you see the instances of indigenous health being, affected by that.
Yes.
But not only just indigenous people, but all people around the world, where you have to have natural products in your system.
Yeah.
One of our theories is, if you know your lineage, if you know, whether it's Italian or German or different, there's natural things that grow in your area of origin.
Totally.
And that's what you need in your system. So you'll see a lot of Asian herbologists here in the region, because a lot of the people still refer back to those as medicine they need in their body. So how do we, maybe it's going that way. Maybe society is starting to see that, that we can actually have better health if we put the right things in our body and stimulate our body to work better.
I hope so.
Yeah.
I do feel like we're kind of moving out of this. I don't know if it's like the pandemic that had a bit of that too. Everyone kind of stopped and they had all this time and they started cooking and doing different things. So I feel like, I don't know, I feel like there was a bit of an awakening maybe, but I don't know how long that's lasted or.
Well, I think you'll see segments of population that want to get, healthier. The gyms that we have now and people that you see out walking and running, doing stuff like that. I think in general, humans have always, wanted to do that, but then we got into a sedentary kind of lifestyle,
Yes.
sitting behind our computers and, not moving as much as we should. But, in First Nation communities, we didn't have jobs like that so much. So everything that we did was going out in the bush, cutting trees down, exercise was a big part of it.
Yes.
And then when the changeover where it was kind of like a dependence on a welfare kind of a system because we couldn't get jobs. So we seen a big change in our living standards at that time, health-wise, food-wise and all those other things. So those are kind of like ideas I want to help the hospital to see more of and how we can strategically
Yes.
rebuild a better avenue.
Yes.
If that makes sense, it's a matter of just trying to
Yes.
converge on knowledge so we can make things better. So I'm glad you're able to join us today. It was a nice conversation and things that we talked about. But going forward, like I said, we're seeing other hospitals now wanting to change their methods and start to build on, things stuff that we're kind of doing too, and what we see in London doing.
Yes.
So I hope that's kind of a motivation. There's now other hospitals calling now, just wanting to how do you engage the community and what we can do different. So, so I think that had a lot to do with what's happening and what you started here at the Grand River. So I want to thank you for that.
I think I couldn't have done it without the support of community.
But there has to be an internal person
Yeah.
to be able to bring that vision to the organization.
Yeah.
The Indigenous community can have those thoughts and ideas, but
Yeah.
you just need to have that doorway.
I think, I reflect back on those initial conversations and I think just hearing and, that awakening to some of those realities and kind of how can we not, right?
Well, we've been speaking with Christine Peters from the Grand River Hospital and the new hospital that's coming up. No name yet on it yet, but we'll get there. And I've been having a great time working with you over the last year and a half and having the Sacred Fires at the hospital. And we're going to do a sharing circle coming up, pretty soon. And, just more things happening, and that's great. So I want to thank you for joining us today here on Niche Vibes.
Thank you, Maigan. Lots of more good stuff to come.
Absolutely. Anyway, thank you for listening today. Hope your winter is going fine and the things that you're doing with your families over the holiday season will be great. This might be aired after, so if I'm giving you a happy holiday and it's over, just think of it. It should be happening all the time, your family and friends. So we say in our language, Bama Pi Minwa. Bama Pi it's a reference to time in the time that we shared together. So we say Bama Pi for see you later, but it really just means that we've spent some good time together recently and had a chance to have good conversation. So Bama Pi Minwa, we'll see you again until our next show on Niche Vibes. And I want to thank Abby for being our technician over these number of shows and done such a great job in getting these done in a good quality way. So with that said, Chimigwech, everybody. We'll see you again next time. Bama Pi.